Hi, good morning. My name is Jahnna from the SN111K Group 41, and today I will be performing the assessment of the abdomen. So prior to the procedure, I had to review the previous medical record of the patient and the doctor's order to verify the order. And then next is to determine the scope of the assessment and prepare the necessary equipment to save time and energy. So the equipments needed are stethoscope, a ruler, and a tape measure. And lastly is to perform hand hygiene to deter the spread of microorganisms. Hi, good morning ma'am. My name is Cayme, your student nurse for today. May I see your wristband please? Can you state your complete name ma'am?
Marris
And your birthday?
October 22, 1978.
Alright, so now ma'am, what may I ask if how would you like to be called?
Alma.
Alright, so Ma'am Alma, today I am going to assess your abdomen. I am going to inspect, auscultate, percuss, and palpate for it. Would that be alright?
Yes, ma'am.
And I may also need you to sit, stand, and do a sideline position. Would that also be alright?
Okay, ma'am.
Okay, so do you have any concern, ma'am?
No.
Alright, so now we are going to ensure the patient's comfort, privacy, and confidentiality. So assuming that I had already closed the door, adjusted the temperature and the lighting of the room, we can now ask the patient if she had already emptied her bladder. So ma'am, did you already pee, ma'am?
Yes, ma'am.
Okay, so now proceeding with the surveying of the abdomen, first thing we need to do is to position the patient in a supine position and also cover the upper and the lower body parts of the patient, only exposing the abdomen. So next is we are going to observe the abdominal skin of the patient. We are going to note for any vascularities, stray or stretch marks, rashes, lesions, and scar. And if there is a scar, we are going to note for its history, its location by quadrant, and its reference line. Okay, next is to inspect for the umbilicus for its contour, color, and location. And then now we can examine the abdomen by its contour if it's round, flat, or distended. So we are going to position the patient in a supine position and then sit beside the patient and look across the abdomen slightly higher than the client's abdomen. Okay, so it's round. And then now is to proceed by examining or inspecting the abdominal girth. So what we are going to do is to look at the between the lower rib cage and the pubic bone and note for any abdominal enlargement. And then now we are going to measure the abdominal girth of the patient. So we are going to ask the patient to stand and use a disposable easily clean tape measure and place it around the patient starting in the umbilicus and then record the distance. And then if there is a distension, we can take all the future measurements and mark those points and then ask the patient to not wash those points unless it is not already needed. Okay, so ma'am, may I ask if you can stand? Can you hold this, ma'am? Okay, thank you. You can now sit and go back to your position. And then lastly is we are going to check for the symmetry. And what we are going to do is to ask the patient to raise her head to assess for any herniation or diastasis and also inspect for abdominal movement and peristaltic waves. So ma'am, can you raise your head? Okay, thank you. Now, proceeding with the auscultation, we are going to auscultate for bowel sound, and first thing we are going to do is to use the diaphragm of our stethoscope and ensure that it is warm before placing it in the abdomen of the patient. And then after that is we are going to apply light pressure if the abdomen is painful. And then start in the right lower quadrant and then clockwise and listen for each quadrant for 5 minutes and then note for any for the pitch, intensity, and frequency. So ma'am, I am going to auscultate now your abdomen.
Okay.
Alright, so next is auscultate for vascular sound. So we are going to use the bell of the stethoscope and listen for bruit over the aorta, renal, iliac, and femoral arteries. And the next is to auscultate for venous hum. So using the bell, we are going to place it in the epigastric and umbilical area. And then lastly is to assess or auscultate for friction rub in the spleen and liver. So we are going to place the diaphragm of our stethoscope in the left and right lower rib cage. So now, proceeding to percussion. First is we are going to percuss for tone. So using the percussion hand technique, we are going to lightly and systematically percuss for all the quadrants in clockwise. So mom, I'm gonna percuss your abdomen. And the next is we are going to percuss the span of the liver. So first is we are going to determine the lower border and we are going to percuss at the right lower quadrant in the midclavicular line and then percuss upward. And we are going to note for the changes from tympani to dullness and then mark the point. So mom, I'm gonna mark this point. And then next is we are going to percuss or assess the descent of the liver. So what we are going to do is to locate the dullness of the liver border of dullness, and then ask the patient to take a deep breath and then perform the percussion, and then afterwards is tell the patient to exhale. So, ma'am, can you take a deep breath and then hold? And then exhale, ma'am. Okay, thank you. And then now is to determine the upper border. So first is we are going to percuss or locate the upper chest, and then percuss in the midclavicular line, and then downward. And then we have to note for the change from lung resonance to liver dullness, and then mark the point. And then afterwards is to do the same in the midsternal line. And then measure the marks. So next is to percuss the spleen. So what we are going to do is to percuss at the posterior left mid-axillary line, and then percuss downward. And then after that is to note for the change from lung resonance to splenic dullness, and then perform the second method to determine for any enlargement by asking the patient to take a deep breath and then percuss at the left interspace mid anterior axillary line. Can you, ma'am? Can you take a deep breath? Okay. So next is the blunt percussion of liver. So we are going to ask the patient to sit and then place our left hand in the lower right anterior rib cage, and then use the right hand to strike it and note for tenderness. So ma'am, can you sit? Can you hold this, ma'am? Tell me if it hurts when I strike it, ma'am, okay? Does it hurt? Alright, so next is the blunt percussion of the kidney. So since the patient is already seated, we are going to place our left hand in the costovertebral angle, and then use our right hand to strike the left hand, and then note for any tenderness. So ma'am, tell me if it hurts when I strike your back, okay? Does it hurt, ma'am?
No.
And how about this, ma'am?
No.
Okay. So you can lay in the bed, ma'am. Thank you. So next is we are going to test for abdominal distensions or bulging flank. So what we are going to do is to percuss from the flank to the umbilicus, and then note for changes from dullness to tympany, and then mark the point. And then afterwards is to assist the patient to turn on the side, and then percuss from the bed upward, and then note for changes from dullness to tympany. And then after that is we are going to mark it. Okay, can you turn on the side, ma'am? Now you can lay back naman. And the next is we are going to test for fluid wave test. So, well, what we are going to do is to ask the patient to place his or her hand firmly in the midline of the abdomen, and then place our left hand in the side of the abdomen, And then use our right hand to tap the other side of the abdomen and then note for fluid movement. Okay, thank you. So proceeding to palpation, we have to position the client back in at a supine position, and then we have to cover the upper and the lower body part of the patient, only exposing the abdomen, and then we have to begin palpating at the non-tender part and using the fingertips of our hand, and then we have to palpate for the quadrant to at a depth of 1 centimeter, and then start palpating. And the next is to deeply palpate to feel the structure. We have to palpate all the quadrants in 5 to 6 centimeter deep, and then we have to note for any structures or resistance, and if there is resistance or structure felt, we have to perform by manual palpation. And the next is to palpate for masses. We are going to use our fingertips and then palpate at the quadrants and then note for any masses, its history, location, size, and mobility. And the next is to palpate the umbilicus and its surrounding. We are going to note for any swelling, bulging, or any masses. And then now we are going to palpate the aorta using both of our hands. We are going to deeply palpate the epigastrium and note for any pulsation. And then now we are going to palpate the liver. First is we are going to stand at the right side of the patient, and then next is we are going to place our left hand at the 11th and 12th ribs at the back, and then our right hand in the right costal margin, and then while the fingertips is facing the head of the patient, and then we have to ask the patient to inhale, and then we have to compress upward and inward to the fingers, and then note for any consistency and tenderness. Okay, ma'am, so can you take a deep breath, inhale. Okay. So next is palpate by hooking. So we are going to stand at the right side of the client's chest, and then we are going to curl our fingers, both of our fingers, and place it in the right costal margin, and then ask the patient to take a deep breath, and then gently but firmly pull inward and then upward with our finger, and then note for any consistency and tenderness. So, okay, ma'am, can you take a deep breath? Does this hurt, ma'am?
No.
Okay. So, next is test for cholecystitis. We are going to use our fingertips in under the liver border, and then we are going to note for any pain or tenderness at the right upper quadrant. And then now is to palpate the spleen, and there are two ways in palpating the spleen. So the first method is to stand at the right side of the patient, and then we have to reach over the abdomen using our left arm, and then we have to place our left hand under the posterior side in the lower rib cage, and then use our right side or right hand to palpate the spleen in the left costal margin, and then we have to ask the client to inhale and then press inward and upward while providing support with the other hand, and then note for any consistency and tenderness. Okay, Okay, can you inhale, ma'am? Alright. So the second method is we are going to ask the client to turn on the right side, and then we are going to palpate the spleen by moving it downward and then forward, and then document the size of the spleen and then note for any consistency and tenderness. Okay, ma'am, can you turn on the right side? Here, ma'am. Okay, you can lay now, ma'am. So to palpate the kidneys, we are going to place our left hand on the right posterior flank, and then this will provide support, and then our right hand in the right upper quadrant just below the costal margin, and then ask the client to exhale and hold his breath briefly, and then gradually release the pressure of right hand, and then we have to repeat it for the left hand, our left kidney. Can you exhale, ma'am, deeply and then hold? Can you exhale, ma'am, and then hold? Okay. So next is we are going to palpate the kidney, and then we have to begin palpating in the symphysis pubis, and then move upward and outward to estimate the bladder, and then we have to note for its consistency and tenderness. And the next is to perform the hypersensitivity test. So using our ruler or a sharp object, we are going to stroke the abdomen of the patient, and then we have to note for any pain or exaggerated reaction, skin reaction. Does this hurt, ma'am?
No.
Okay.
How about this, ma'am? No.
Alright. So next is test for psoas sign. We are going to ask the client to lie on the left side, and then we are going to hyperextend the right leg of the patient, and then note for any pain or an reaction of the client. So ma'am, can you turn on the side? Alright. So I'm gonna lift your right leg, ma'am. Tell me if it hurts. Does this hurt, ma'am?
No.
Okay. You can now ride mo ka. And the next is the test for obliterator sign. So we are going to hold and support the client's right knee and ankle, and then we are going to lift it and then rotate it. And after that, note for any pain or reaction from the client. So ma'am, tell me if this hurt.
No.
Okay. And the next is we are going to test for appendicitis. So for assessing for rebound tenderness, we are going to palpate deeply at 90 degrees. And then we are going to suddenly release the pressure and then listen and watch for the reaction of the patient. And then we are going to ask her if it hurts more to when I press it, or if it hurts more when I release it. And then ask the client where the abdomen pain occurred. So ma'am, does it hurt when I press it, or does it hurt when I release it?
No.
Okay, none. So now since we are done, we are going to help the patient to dress up and put up her clothes, and then summarize the documentation that we had gotten. So now, ma'am, since we are done with our assessment of your abdomen, I'm going to summarize all the information that I have gotten. So upon inspection, your abdomen skin is uniform on color. There are no rashes, scars, lesions that I had observed. Your umbilicus is also in the midline and it's inverted, which is good, and your abdomen is symmetrical. And also upon auscultation of bowel sounds, sounds are normal. There are no bruise, venous hum that I've heard. So, and also while measuring your liver size in the mid-clavicular line, it is in 7 centimeter and it is 5 centimeter in the mid-sternal line. And upon percussion and palpation, there were no tenderness, no masses, no bulges, and no swelling. And overall, your abdomen is in good condition. Do you have any questions, ma'am?
No.
Alright, so before I leave you, ma'am, I just want to give you some advice on how to keep your abdominal internal organs healthy. So first of all, I would like you to avoid too much drinking of alcohol or hard liquor because it may damage your liver. And also, instead of drinking hard liquor, you can increase your fluid intake, such as water, to flush out unwanted waste in your liver, gallbladder, and intestine. And if you have the urge to pee, do not delay it or do not hold it because it is a bad habit that may cause disease. And it is not also recommendable to hold your pee. And do you have any questions, ma'am?
No.
Any concerns?
No, ma'am.
Okay, so I thank you for your full cooperation during this day, and that's all. Thank you.